If you're watching this video, chances are you've asked Dr. YouTube about HIV symptoms, or you've stumbled upon this content out of a genuine interest in understanding HIV better. The insights shared here are relevant regardless of gender identity. Stick around for a comprehensive overview of the typical early indicators of HIV, along with details on testing and prevention. But before we dive in, remember to hit the subscribe button and turn on the notification bell for more health-focused content. Without delay, let's delve into it. Remind me, what is HIV? HIV, an acronym for human immunodeficiency virus, targets the immune system, specifically impacting white blood cells like CD4 cells or T cells, crucial components of our body's defense mechanism. Due to its assault on the immune system, HIV renders the body less capable of mounting a robust defense against the virus compared to other pathogens. Consequently, individuals with untreated HIV become more vulnerable to various infections and illnesses. The transmission of HIV occurs through contact with bodily fluids containing the virus, such as blood, semen, or vaginal fluids. Globally, an estimated 37.6 million people are living with HIV, with approximately 1.2 million residing in the United States alone. While men comprise around 47% of global HIV cases, research from 2018 indicates that in the United States, men account for 81% of HIV diagnoses. Mode of transmission. It is primarily spread through sex, sharing needles, blood transfusion, and mother-to-baby during delivery. HIV versus AIDS. Now let's talk about the virus HIV and AIDS. HIV is not synonymous with AIDS-acquired immunodeficiency syndrome, AIDS. Is also known as Stage 3 HIV. It's a late stage of HIV, when the immune system cells have been so badly damaged that the body is no longer able to fight off infection. Thanks to modern medicine, with proper treatment, it's incredibly uncommon for HIV to progress to AIDS. More on that in the later part of this video. Stages and early signs and symptoms of HIV. Before delving into a detailed discussion on HIV symptoms, it's crucial to grasp that untreated HIV typically advances through 3 distinct stages, each accompanied by a set of associated symptoms. Stage 1, acute illness. Stage 2, asymptomatic period. Stage 3, advanced infection. Now, here is a complete breakdown of the most common symptoms by stage. Stage 1, acute illness. Stage 1 of HIV can be considered the beginning stage. It's the stage a person enters when they first contract the virus, and it lasts until the body has created antibodies against the virus. Antibodies are basically little bodyguards the immune system creates when exposed to foreign invaders. Somewhere between 66 and 80% of people in stage 1 will experience flu-like symptoms within 2 to 4 weeks of transmission. These flu-like symptoms can include fever, swollen glands, fatigue, body rash, sore throat, joint pain, diarrhea, headaches. Early symptoms can also include ulcers in the mouth, sores on the genitals, muscle aches, nausea, vomiting, night sweats. So why the joint pain, you may ask? When someone has symptoms, their symptoms can last a few days to several weeks, but not everyone who has come into contact with the virus will experience symptoms. It's common for someone to experience no symptoms that would lead them to question whether or not they'd been exposed to HIV. That's why anyone who has these symptoms or thinks they may have contracted HIV should consider scheduling an appointment with a healthcare professional to get tested. You want to know your status as soon as possible, as early treatment is best for preventing future illness or symptoms. Stage 2, asymptomatic stage. Also known as the clinical latency stage, this stage of HIV is known for its lack of symptoms. During this stage, the virus exists and is multiplying in the body and is beginning to weaken the immune system, but it is not yet actively causing symptoms. A person with HIV at this stage may feel and look totally fine, but they can still easily transmit the virus to others. Stage 3, AIDS. It may take years, even decades, but when left untreated, HIV may attack and destroy enough CD4 cells that the body can no longer fight off infection and disease. In short, it breaks down the immune system. Once this happens, IV will progress to stage 3, often referred to as AIDS. A person at this stage has a severely damaged immune system, making them more susceptible to something called opportunistic infections. Opportunistic infections are conditions that the body would normally be able to fight off, but can be harmful to people who have HIV. People living with HIV may notice that they frequently develop colds, flu, and fungal infections. The symptoms someone with stage 3 HIV might experience include nausea, vomiting, persistent diarrhea, chronic fatigue, rapid weight loss, cough, shortness of breath, recurring fever, chills and night sweats, rashes, sores, or lesions in the mouth or nose, on the genitals or under the skin, prolonged swelling of the lymph nodes in the armpits, groin or neck, memory loss, confusion, or neurological disorders. When someone's CD4 count drops below 200, that's when someone becomes susceptible to opportunistic infections like pneumocystis pneumonia. This may all sound pretty scary, but remember that HIV can be managed with medication called antiretroviral therapy. More on this in this video. How is HIV diagnosed? HIV is typically diagnosed with a blood test, though it can also be diagnosed with oral fluid or urine. Most commonly, healthcare professionals will order one of the following tests. Nucleic acid test, NAT, looks for viral load in blood. Antigen antibody test looks for both antibodies and antigens in blood. Antibody test looks for antibodies in the blood. It typically takes a few days for NAT and antigen antibody tests to provide results, but there are rapid antibody screening tests and rapid antibody screening tests that take 30 minutes or less. Another option is to use an at-home HIV test kit. Many of these home tests do not require sending the sample to a lab. A simple oral swab can provide results in 20 to 40 minutes. Regardless of your result, consult with a healthcare professional so that they can confirm with more advanced testing equipment. How often should you get tested for HIV? Everyone between ages 13 and 64 should get screened for HIV, as you would be tested for any disease as a regular part of routine medical checkups. But the right cadence for how often you get tested will vary based on your solo or partnered sexual activity, the anatomy of your sexual partner, and the type of sex had, and intravenous drug use. If someone is in a monogamous relationship with an HIV-negative person, there's no need for continued testing unless there is concern for outside play. If you've engaged in sexual activity with multiple partners, it's advisable to undergo testing annually as a minimum requirement. For individuals with penises who are sexually active with others of the same, testing every 3 to 6 months is ideal. Annual testing is also recommended for those who inject drugs. If you frequently engage in sexual encounters with partners whose HIV status is unknown, considering testing every 6 months is prudent. Following a known exposure to HIV, it's essential to get tested 18 days post-exposure. Additionally, immediate initiation of HIV prophylactic prevention medication, akin to emergency contraception for HIV, is recommended. This medication can significantly reduce the risk of infection if taken within 72 hours of exposure. Prevention of HIV. What else can you do to help prevent the spread of HIV? First things first, know your own current sexually transmitted infection. STI status. An estimated 13% of people living with HIV do not know that they have it. Knowing your current STI status can help prevent an HIV-positive person from transmitting the virus to others. To know your most current HIV status, it's important to get tested if you have any of the aforementioned symptoms or there's a possibility that you contracted the virus. If you test HIV negative, the best way to remain negative is to avoid exposure to bodily fluids that may carry the virus. However, these measures can help reduce the risk of contracting HIV. Share your current STI and HIV status with any potential partner and ask for theirs. Knowing their status will help you make the most informed decisions. Use condoms for any kind of penetrative play, vaginal, oral, anal. When used correctly, condoms are highly effective at protecting against HIV. Try not to share or reuse needles. Take precautions. Always assume that blood might be infectious. Use latex gloves and other barriers for protection. Talk with your healthcare professional about pre-exposure prophylaxis, PrEP. PrEP is daily oral ingestible that HIV-negative people can take to reduce their risk of contracting HIV if they're exposed to the virus. What's the prognosis for those with HIV? While there is currently no cure for HIV, receiving a timely diagnosis and early treatment can effectively decelerate the advancement of the disease and greatly enhance one's quality of life. It's crucial to understand that HIV is no longer the fatal prognosis it once was. Modern HIV treatments are both simple and highly effective. With consistent adherence, individuals can lead long and healthy lives while significantly reducing the risk of transmission to their partners. Research even suggests that individuals who commence treatment before substantial damage to their immune systems may enjoy a life expectancy comparable to that of the general population. In conclusion, recognizing the early signs and symptoms of HIV is paramount for timely diagnosis and effective management of the condition. By staying informed and vigilant, you empower yourself to take control of your health and well-being. Remember, early detection can make a significant difference in your journey with HIV. Don't hesitate to subscribe for more essential health-related content to stay informed and proactive about your health. Your subscription ensures you stay updated with valuable information that can positively impact your life. Subscribe now and join our community committed to promoting health and well-being for all.